Hi, I am your medtech for today, and this is clinical microbiology. So it is very important for the medical technologists to ensure that there is a filing of the proper request form, selection of the specimen, appropriate collection of the specimen, and proper handling of the microbiological specimen. The pre-analytical of the standard operating system should deal with appropriate specimen management. Correct specimen management should be considered for the accuracy of the laboratory diagnosis. Correct laboratory diagnosis will greatly affect the patient's care, length of stay, and hospital costs. It is the responsibility of the laboratory to provide a proper specimen management and collection of it. The laboratory should impose specimen policy as strictly as possible. The specimen must have a requisition form, and the requisition form should include the following. Number 1, the patient's name. Number 2, sex. Number 3, date of birth. Number 4, the address. Number 5, record number for outpatient and hospital inpatient. The printed name, practice address, and telephone number of the requisiting physician. Number 7, description of the specimen, which include if it is a stool, a urine, a sputum, rectal swab, and etc. The date of request, date and time of collection, and the form should be designed the submitting clinician that gives all the information needed by the laboratory staff to determine the nature and range of the test to be done. Number 11, clinical note summarizing the patient's illness, day of onset of illness, and provisional diagnosis. Number 12, request form should be specifically has the details of the type of examination requested with notes of patient's occupation, travel, immunization, and any antibacterial therapy. Collection and transport. Guidelines for collection and transportation of the specimens. Number 1, collection of the specimen before the administration of antimicrobial agent. Number 2, prevention of contamination of the specimen with externally present organism or normal flora of the body. Analytical stage. All the specimens should begin with a microscopic and physical examination of the sample. Stain should be clearly labeled, and expired stain should not be used, and there should be a controlled smear for the stain. And lastly, equipment should be checked and calibrated. There should be a proper label of the agar, which contains the following: the name of the patient, number 2, the type of the specimen, the date, and the accession number or the unique hospital number was used. Plastic calibrated loop is also used, and since it is urine, simple streaking has been done. Blood agar first before the McConkey. In post-analytical, result is in successive days. The standard procedure are the following. Letter A, reporting and verifying test results. Letter B, interpreting test reports correctly. And lastly, taking appropriate action when a result has serious implication for a patient or public health. Thank you for watching. Bye!